Hey there, welcome to the Rehab mobile YouTube channel where we help people heal from pain so that they can transform their body and their fitness and get the life and the health they've wanted for a long time. I'm Dr. Toby. I'm a physical therapist and health coach. And in this video, we're going to talk about 3 things you can do right now to relieve pain in your knee if you have a potential meniscus injury or if you already know you have a meniscus injury. Now, what you may want to understand about a meniscus injury is that there is not necessarily one way to approach it. Some will tell you that you immediately need surgery, but others will tell you that rehab and therapy can definitely transform where you are to be able to do the activity that you love, bend your knees better, straighten them, sleep better at night, and get back to physical activity. And both are really true. For some people, their meniscus injury is so severe to the point where they need some type of procedure. But now what's really common is that a lot of physicians and surgeons will not even do any type of surgery for it or operation. They'll send you straight to therapy, and that helps a tremendous amount of people. Now, if you have a meniscus injury and you have severe conditions and pain, there probably is some arthritis that is possibly developing, for which some surgeons or medical professionals will perform a joint replacement surgery or other types of procedures. So how do you know what applies to you? The best way is to know by talking to a specialist, someone who deals with people who have meniscus injuries and helps to rehab and repair them. And we help to do that all the time for patients. And so if you are looking to get some more information about your particular scenario, the best way to do that is to click on the link in the description or to text or call our office number, and you'll see that information down below as well. But I want to give you some quick helpful information. Some people may right now be watching this video looking for some quick help and relief to relieve some of their pain, because this affects you when you're bending your knee, you're straightening your knee, or when you're going up and down stairs or sitting down. Whatever involves compression of that knee joint or causing the knee to approximate and get closer together, that causes pain in the knee. And the whole purpose of the meniscus is to not only provide a lubricative type of surface, but also a shock absorbing surface that improves kind of like a cushion. It improves the compression and the sensation within the knee joint and relieves some discomfort. So what I'm going to show you here are a couple of things that you can do that will directly cause some improvement and reduction in pain in terms of your knee discomfort. So let's get right into it. One of the first things that you can do that will be helpful for you in terms of relieving the discomfort in your knee is getting a firm surface, like that's not too firm, like a pillow or a ball that is flexible, and squeezing your legs together. Holding that for 5 seconds and relaxing. And squeeze those legs together, just like that. What's really important about how you do this is also the position and the movement of your feet, because if your feet are too far apart from one another, you can be invoking a position that causes more stress and strain on the medial part of your knee. So as I'm demonstrating here, you want your feet well positioned from one another, not too far out, and not putting your hips in an internally rotated position, therefore causing your knees to be turning inward. The other thing that you want to do is improve the contraction of your quadricep muscle to invoke and facilitate better stability. So this may be comforting for some people, and if that's the case, this is one that you want to, again, stop from doing before you can get some further help or assistance in understanding what's going on with your particular knee. And again, if that's you, click the link in the description and text our office and we can get you some support. But what you're going to do is a quad set. So I'm pushing my knee all the way down, pointing my ankle back toward me. And this muscle is nice, tight, and hard right now. Starting off, you can hold it for 5 seconds, but improving that contraction will help to improve stability, protection, and really relieving pressure and stress from the joint. So getting up to a 10-second hold can be one of your quick early goals, because that can make a very big difference. Once you've held it for either 5 or 10 seconds or however much, you can relax and do it again. You want to do this several times. For both of this exercise and the previous one where you're squeezing the pillow, the hold is important, and doing two sets of 10 or 3 sets of 10 can be really important. But I would start off with what feels comfortable, unless you're talking to someone who has given you some specific guidance, and that's really important. The last exercise and activity I'm going to show you is really simple. The knee that is problematic is going to hang off the table just like that. Assessing the right position is really key, but letting your leg just hang and rest down is really helpful. What we're allowing here is a distraction of the joint, and one of the things that will be apparent when you're doing this exercise is the stretch on your hip flexors on the front of your thigh is going to feel pretty intense, but you want your leg to be just completely relaxed. The knee bent here is important for making sure your back feels okay and not too much stress or strain. And how you can progress this or improve the effectiveness of this is by using a strap, or if you're at home, a blanket or a belt to pull a little bit on that knee. All right, and here is a bonus. Using a massage ball or a foam roll can be really helpful. Finding those tender spots, avoiding excessive pressure that causes sharp pain or discomfort can be really big. Making sure your leg is relaxed. That is going to make a very big difference, because some of those muscles, in their attempt to reduce the pain where you feel it in the meniscus, have probably been overworked and stressed. And so relieving the tension there with some mobilization to those tissue. Mobilization meaning we're helping to improve how those muscle tissue contract and how they move when you're actually using them. And that can make a very big difference. All right, so in this video, I've shared 3 things that are really helpful for getting some immediate relief when it comes to having a meniscus injury in your knee. And hopefully these things have provided you some great help, and your feedback and just your testimonial are appreciated in the comment. But if this hasn't helped you or hasn't been beneficial or hasn't addressed your issue, that's not a problem at all. The truth is that every situation is different, and there are people who are at different degrees of injury or rehab and recovery. And what that simply means for you is that you can still benefit from talking to someone who can give you more specified guidance in terms of how to move forward in your recovery process and getting back to the things that you love, whether it's running, whether it's sports, whether it's activity, whether it's simply moving around the house and standing for a longer period of time in the grocery line. And those things make a difference for all of our lives. And this is all about you being able to do the things that you love doing. And so you want to get the help that you need to give you the quickest and the straightforward way to improving where you currently are. I hope this was helpful. Please leave a comment if it was, like this video, and share it with somebody who would benefit from it. And also, if you are interested in getting more educational content that's helpful in terms of videos, subscribe to our channel and hit the bell notification so that you can stay abreast of all of the amazing content and videos we're going to be sharing. All right, take care.